Now for the leg area, again, with any joint regions, you can actually go into those areas to build up it. But again, you can actually bring it this way. But again, don't put a lot of pressure right on the tibia bone if you're doing a lot of cross-handed for that area. For more of the quadricep region, you'd actually kind of separate this way. So eventually it's going to go around like this. But try not to go up too high because the other hand, just be where it's at. So again, just kind of separate. Or you can do more of a cross-handed for this area. And with this hand, sometimes you might want to actually have it angled up a little bit, even though you're tensing it up a little bit, but in this area, just be more cautious of where you're placing your hands. And with this, you can actually ask them to kind of pull up their shorts a little bit. So right like this. So you can get more of the upper region of the quads. So again, directly center is the rectus femoris. Vastus medialis, more medial side. Vastus lateralis, lateral side. Okay, now for some stretching of the adductor regions, what we're going to do is we're going to flex, externally rotate, so you can actually kind of separate the adductor region. So again, you can have cross-handed stretch, but again, beware where this hand is. So you can even use your knuckle if you need to, or just actually plant it, and this hand doesn't move at all, but this one moves a little bit more. But if it's too uncomfortable for him to be in this position, actually put a bolster underneath there, or you can ask permission. You can actually rest your knee like this, so you can actually perform the stretch like this, so it's a little bit more comfortable for them. Okay, next one. More for the vastus lateralis region, tensor fascia lata region, but even though it's a small muscle up here, but the IT band, also the biceps femoris. So what we're going to do is you can actually perform a regular stretch, but then incorporate the fascia stretch into it. So this is a stretch that a lot of people need on a regular basis, but they just don't perform it then. So a lot of times people, you can actually look at their foot. So if their one foot is going out a little bit more than likely the one side is actually rotated out. So the piriformis, the gluteus maximus region is a little bit more tight, so that's why the foot is going out more. So that's why I always visually look over the body too, what areas you should concentrate on a little bit more. Okay, next one we're going to do is you're going to flex. Then you're going to put it right on your hip area, like this. Then you can just do a little bit of stretch. But with the other hand, try not to hyperextend, of course, but then you're just going to go down in a direction where you can actually go across too. But again, it's getting stretching in two different areas. So right here, where I'm actually stretching, and also the gluteal region, the piriformis region, that I'm actually stretching too. Okay, next one, you can actually put it up like here like this, flex the knee, flex the hip. And what you can do too is, just so they feel a little bit more comfortable, you can actually put this right over here on their foot and ask permission to actually sit on their foot region. So what you're going to do is you're going to actually go like this, lean back, and then you can actually separate the gastrocnemius region and the soleus region by just leaning back, so eventually bringing your hands out like this then. Then you can also, with the quad region, you can actually interlock, kind of go down, or you can actually rest your anterior deltoid region and just go down that way too then. Okay, again with the leg, like I showed you earlier in this section, you can actually bring it out. Okay, so especially if they're actually more rotated in, you name it, just go in different directions. You can even bring it across the body too to stretch it out. So eventually the leg is going to rotate a little bit more in that area. But if somebody has problems in their knee, especially at their back knee, it might be a little bit discomfort. So that's why you want to ask them if there's any kind of pain or burning sensation when you're performing these kind of techniques. So again, you can actually just do a traction this way too, just bringing it down like this. So with this too, you can also rest it on your anterior deltoid region, like this. So you're going to bring it here, and you can actually go down the hamstring region. And you can even use your knuckles if you need to. Perform, again, it's a stretch, and a fascia stretch too for those areas. Okay, let me go to the hip region, the abdominal region.